Hello and welcome to the NGO Whisperer Show. My name is Dr. Carolyne Opinde. I'm the founder and CEO of the NGO Whisperer Center for Social Impact based in Manchester, United Kingdom. Here at the NGO Whisperer Center for Social Impact, we work with non-governmental organizations, social enterprises, governments, and funding agencies to promote social innovation and investment for a sustainable world now and in the future. In season 6 and 7 of the NGO Whisperer Show, we focus on the work of our Global Fellows class of 2022. Joining us today from Johannesburg, South Africa, is Adi Shachar. She is the founder and executive director of Heartbeat Clown nonprofit company. Adi, welcome to the show.
Thank you, Dr. Carolyne. It's lovely to be here with you.
Adi, we are so honored to have you as one of our global fellows. You have other skills working in corporate South Africa, but you founded a nonprofit, Heartbeat Clowns Foundation, and you're working with children who are terminally ill, bringing joy to them. What inspired you to step into the nonprofit sector? And tell us a little bit about your story.
Thank you, Dr. Carolyne. So I decided at the age of 50 that I wanted to follow my passion. And as such, my passion has been working as a therapeutic clown at Charlotte Makeke Hospital. And I wanted to give back to the community. So it just came about that I ended up founding the organization with two friends who joined me to start the nonprofit business. But we actually call ourselves more a social enterprise because we don't only work with children, we also work with adults, and we also work with the elderly who may have dementia, Parkinson's, and other ailments. My story is quite unique. I've been in the corporate sector for a long time, but my heart was really yearning to do something else and follow my passion. And I started volunteering as a care clown at the hospital, and I thought there was more to doing this, and also looking at opportunities to create a change and a difference in our society. So that was really where Heartbeat Clowns came from, to address some of the social issues in our community. So we focused on upskilling unemployed youth in the art of therapeutic clowning through an internationally qualified program. And then once they are trained, we then take them into the hospital environment or to any healthcare facility that needs or may find use of the services of a therapeutic clown.
Could you walk us through the process of how you work with your patients? Your typical day, what does it look like when you walk into a ward of children? Let's say, children living with cancer and they're in the hospital. How do you go about this, building relationships with the hospitals? And you mentioned you are in Charlotte Makeke Hospital in Johannesburg. Yes. Walk us through how you got there, because that is an interesting story. And give us a picture of what your day looks like when you are dressed up as a clown.
When we work in a healthcare facility, whether it be a hospital or a hospice or an old age home, it's not really a full-time job. There's a lot of energy that is exposed, and also it's something that we usually don't spend more than 2 hours at a time in a facility. It's actually quite draining, performing and, doing this type of work. So, and it's also, there is also a background in terms of that it's not really health-wise for the clown, because you can actually end up being drained from being overexposed. So we look at 2 to 3 times a week at a facility, and that would typically be 2 hours a week, and building a regular schedule with a hospital, hospice, or whoever. I think the difficult part is building relationships and connecting with people. It really starts off from the time finding the right person at the hospital, engaging with them, working out a schedule, determining which days are best suited, which hours are best suited, and only then do we come in as the clown to actually come and do our work. So there's a lot of background work that takes place before we actually walk into that hospital environment that we don't really consider, because you think, oh, it's so simple, just the clown can pop into a visit. But there's lots of protocols in hospitals, and obviously one needs to be cognizant of those protocols and adhere to them. So typically, I mean, the joy and the amazing feedback that one gets from actually coming into that environment is it's something that really transforms you, because you leave the hospital feeling so much more empowered and feeling really good about yourself after you've done a session with children. Children, old people, it doesn't matter, whichever your audience is. I think the biggest thing is just, going into that environment, because we not only connect with the patients, we also connect with the staff, which is also so important, and also the caregivers, and if they're parents that are or visitors, we also connect with them. So it's not only us connecting solely with the patient that's in the hospital, but it's actually the whole environment. From the time we walk in with meeting the security guard, to the hospital staff, walking through the entrance, taking the lift up to the floor where the ward that we are going to visit. So there's lots of people we engage in that time. Also, when we're not a scary clown, so we don't wear we're not the Ronald McDonald type of clown with lots of makeup. We're very minimalistic. We wear a red nose, and usually each clown has their own identity. But most of our clowns would wear something to identify themselves with, which is a white coat with just the analogy of being a doctor, and but obviously really over the top. So each clown comes in with their own personality and their own agenda when they come into the hospital environment.
Over the last 6 months, you've been with us here at the NGO Whisperers, one of our Global Fellows, class of 2022. Adi, what inspired you to apply to be one of our fellows?
I think it was where I first heard you. I attended a conference where you were one of the speakers, and you spoke about the fellowship program. I think maybe you mentioned it, and obviously I was so excited. I was like, wow, there's the program where I can learn more about how to manage my social enterprise. So I went on to your website. I looked at the criteria and I was like, no, this is so amazing. I did also, in the course of the year, you were running regular workshops once a month on different topics, and I attended that, and that just whet my appetite a little bit more. So I just knew that this was something I really wanted to participate in, and yes, I was so keen to be part of the class and hoping that my application wouldn't be rejected and I would be able to participate in the group. And I've really been very happy with the outcomes.
We are so honored to have you. Thank you for joining us. And the conference that I spoke at is by Jill Ritchie, a good friend of mine
Yes, that's right.
now. Yes, based here in the UK, and she's South African as well.
Yes.
And she does a lot of work in promoting and equipping nonprofits, specifically in the area of resource mobilization and capacity building. So Jill Ritchie, wherever you are, I want to say thank you. The power of connection, the power of partnership. Now, you have completed the 6-month rigorous program. You mentioned some of the modules that spoke to you. What are your top 3 new areas of learning or insights that you would like to share with us today?
I definitely think monitoring and evaluation is something that I had no idea of. It was completely new to me, a new area to me. And it's really something that I think we as social enterprises do need to consider before embarking on implementing a program or putting together a project that's aligned to what we're doing. I did that in retrospect. So, I've put a theory of change together after, I've actually our company's been running for a while, a few years now. But it is something definite that I would recommend that people focus on. And it's also assists, I think it also assists with you having material to share with potential donors to actually showcase what your work is about. And I think that's, for me, been one of the most difficult areas about finding people to align to our project in terms of funding. And that would go then to the second thing, the second subject that really talked to me, which was the grant writing, which is, I think, one of the modules that you presented, if I'm correct. Because I'd never been exposed to, I thought, it's easy to connect with people and source funds. But I've subsequently learned that it's not as easy as one would think. And I think people have to have some background knowledge or skills to actually do this, to look for funds and build relationships and connect with the right types of donors who support what you're doing and are aligned, that your goals are aligned. So those are the 2 subjects that really spoke to me. And also the other 2 that I liked was the change management, which was also fascinating for me. And then the health and wellness, I found also very interesting, because often we only look at the theoretical aspects of, running a business and not look at the other side of balancing our lives emotionally, having our emotional well-being should also be in the right space if we're running a business. So for me, I actually think those were the 4 subjects that really, really, really spoke to me.
Thank you for sharing that. And for all our masterclass and global fellowship program faculty members, thank you. Now, how has your organization changed as a result of you implementing the learnings, whether it's from grant writing, monitoring, evaluation, change management, and even the health and wellness? And at a personal level, as a leader, how have you grown?
Our organization really took a huge knock during COVID, as we were not really allowed or permitted in South Africa regulations became very strict and stopped us from actually doing our work. So it did have a huge impact on me, mentally and emotionally, because I had great ambitions and great goals and lots of things that I wanted to happen, and everything took a standstill. So it was almost like, our organization never really progressed for almost 2 years, and we weren't able to do anything for that period of time. And in that time, I will be honest with you that it did have a huge impact on me emotionally and mentally, because, not being able to see growth or actually see things moving, because I'm the kind of person that wants to see change, and I want to get things done. And obviously there were these restrictions, and I felt like my hands were being tied and I couldn't move, and there was no one to talk to, and it became exceptionally difficult for me. So I do believe that I spent a good part of last year focusing more on my own mental health and emotional health as well, which was something that I realized that I needed to take priority on, because there's no point in helping other people when you aren't in a good space yourself. So whilst there hasn't been much progress moving forward, the I would like to say that this year is the year where we are going to start seeing things happen. I'm feeling much better. I'm in a better space emotionally and mentally. So I'm looking forward to growing the organization, taking my learnings, connecting with more people. I'm hoping we can get together again and resume our work on the identified donors, which we already started last year, and actually start, moving forward. I think this is the year. I think things have changed. COVID has put us back for whatever period of time, but it's now time to move forward and focus on building the business. And, now that I've acquired some skills, I believe that I'm in the right frame of mind as well, in terms as a leader, to take the organization forward.
Absolutely. The future looks bright for you. I can attest to it because I work with you also as one of our VIP clients, looking at how we can move forward. What is your feeling about the work that lies ahead? You've said 2023 is the year that you're now going to implement all these things. Restrictions have all been taken out. You can now freely go into hospitals, and you are in the right frame of mind. Share with us a few things that you have planned this year.
For me this year is to have, we've run a pilot project, and then COVID came. So we haven't really had the opportunity to actually implement our program. Everything has been on the back burner, and everything's been, waiting for this time, waiting for that time to start. But I've come to realize that time is of the essence. You have to take the opportunity and just go with it. So that's why I'm saying, yes, this is definitely my year, and I'm really, really looking forward to getting this project up and running and finding the right donor who speaks the language and understands the work that we're doing, and enabling us to do the work. Because without having trained clowns, our organization doesn't exist, because we need people to be trained to actually go out into the healthcare facilities to complete this work. And in order to do that, we need funds to train those people. So it's imperative that we find the right donor who wants to see social change, who wants to uplift their communities, who wants to be involved and encourage youth to find new vocations new types of work, because there's so many young people that are unemployed. And my whole idea about building the organization was to create jobs and work for these people. So this is really where I want to address what our intentions are and move forward and get more people trained, because the more people trained, the more facilities, the more people that we can reach.
Thank you, Adi. You're not only empowering people to be clowns and bring joy to those who are suffering, whether they are in hospices or in hospitals, but you're also creating a job opportunity for unemployed, especially unemployed young people. Adi, what message do you have for governments, specifically the government of South Africa, civil society organizations, and good citizens in contributing to bringing joy into communities through performance arts and drama?
I think the arts is sometimes an area which funding isn't always as there's not always funding. A lot of the other entities, do get funding. But I'm hoping, because we are building a middle ground where we actually taking youth, growing their skills through in the healthcare sector, and we're also creating opportunities, I believe, because we've created a talent pipeline in our program, where we say that an unemployed youth can enter into the program working as a therapeutic clown, but that's not the be all and end all for them. There's opportunities for them then to move into the healthcare sector and grow in other areas, for instance, as a social worker, or maybe even moving into a medical doctor, as a caregiver, as a nurse. So the skills that they acquire through the 18-month learning program are entry-level skills that they can utilize in future projects, because the course is accredited. It's a university NQF level 4, although we're not aligned with the South African standards, but it's an international accreditation. It's a diploma. So it does have a lot of weighting in terms of adding value to a youth's CV in terms of whether they would like to progress. And there's also opportunities to grow this as a profession. We are working, we have been trying to get the profession registered as a professional skill, because we do believe that this is not a work for volunteers. We're actually looking to train and upskill people who can be compensated for their hours of work. So we want people to recognize that this is not just a fun and laughter. Although there is fun and laughter in it, it's a serious business and a serious profession that we're trying to build in South Africa. And I think my dream is to replicate the model in other countries, because Africa has there's a lot of spaces where there is trauma. And this is the type of work that could really address people who are in traumatic situations. So my goal is, if we could get this model right in South Africa and get government and civil society to acknowledge the benefits of therapeutic clowning and what it does, and how it can influence not only the people that work in these environments and the patients and the caregivers. It actually touches on so many people, the touch points. So it's just because it's a new type of work. and not known in South Africa. It has a global reach in many countries across the world, and is well known. But when you talk about therapeutic clowning, people don't understand what it is and what it means and what does it involve. So I think it's educating people, going out and educating people on what the work is about. So I look at opportunities also where I can talk to people, present what our work is, what our attempts to do, what we're trying to do. And hopefully there will be somebody that is in the audience that listens and sees the value that we add in to society through our work.
Absolutely amazing. The work that you do as therapeutic clowns, or medical clowns as it's known, it's really important. It is a new area. However, we believe that you, as the pioneer, you can take it further. And so I'm going to ask you, if there are people who are looking forward to collaborating with you, to working with you, if there are funders out there who are looking to supporting your work, how can they find you? Where can they connect with you?
We have lots of social media channels. So it's Heartbeat Clowns. You can find us on most of the social media channels, and you'll find all our details there.
Thank you so much. And if anyone is looking forward to connecting with Adi, you can also connect with the NGO Whisperer, and we will relay your message to her. Adi, thank you so much for joining us today.
Thank you. Thank you so much for the opportunity. And I look forward to building future relationships with people across the globe.
Thank you. Ladies and gentlemen, it's been a great honor and a pleasure to for you to join us today at the NGO Whisperer Show and to listen to this new world of therapeutic clowns, or medical clowns. And that's the work of our amazing global fellow, Adi Shachar, based in South Africa. We invite you to connect with us and to subscribe to our YouTube channel, follow us on social media. As Adi mentioned, she gained a lot through our masterclasses, and so we invite you to join us for our 4-week high impact masterclasses throughout the year from January to December. Go to ngowhisperer.com/masterclasses and sign up. Bring your team members, bring your board members, bring your collaborators. Let's build your capacity and help you to be effective in impacting people's lives. Ladies and gentlemen, thank you for joining us. As always, it's all about connecting people, raising funds, and impacting lives globally.